Hi, I'm Chris, I'm a student RN, and today I'll be demonstrating the proper use of a nasal cannula. So the first thing I'm going to do is I'm going to wash my hands. I can find hand sanitizer. And the next thing I'm going to do is I'm going to identify my patient using two sources of identification. I'm going to ask the patient to state their full name and date of birth. And I'm going to confirm that on this wristband. Sam Samuel, date of birth 10/6/04. Next thing I'm going to do is I'm going to explain the procedure to the patient. So today, Sam, we're just going to be placing you on nasal cannula, and it'll be set on 3 liters. So where I got that from is I would check the order from the doctor and confirm that it's between 1 and 6 liters. So it's set for 3 for him. So I provide privacy by pulling the curtain around. The patient's already set at the correct height. I've confirmed their identification. I've explained the procedure to the patient. I've washed my hands, and now I'm just putting on PPE. So the tubing is already hooked up to the oxygen here. I still need to set it though. And the order says 3 liters. So the little ball is set at 3. And then I'm taking the nasal cannula and I'm checking the prongs to make sure that there's oxygen coming out, and there is. So the prongs are going in through the nostrils and around the ears. And I'm tightening it at the bottom. So if I notice any redness or irritation behind the ears, I could set gauze behind there to help. And I'm just making sure the tube isn't kinked either. So after setting the nasal cannula, I would reassess the respiratory status, the quality, is it bilateral, are they breathing well on both sides? I would assess lung sounds. And then after 8 hours, I would replace the tubing, and that's it. Hi, I'm Chris, and today I'll be demonstrating the use of the simple face mask with oxygen. First thing I would do is I would wash my hands and apply PPE. I would identify the patient using 2 sources of identification. I would have the patient state their full name and date of birth, and I would confirm that on their wristband. Sam Samuel, date of birth 10/6/2004. I would also explain the procedure to the patient and provide privacy. So today, Sam, what we're going to be doing is we're going to be placing you on a simple face mask. And the liter flow for that is 6 to 12 liters. So I would confirm on the order what liter flow the doctor wants him at. So for this case, the doctor wants him at 10 liters. So the mask is already hooked up to the oxygen here on the wall. I'm going to turn it on and place it on 10. And I could hear the oxygen coming through, and I'm going to reach in and I could feel the oxygen coming up and through. The mask will go over the forehead, behind the ears, over the nose and mouth. And then obviously this mask is a little too large for the mannequin. However, I'd make sure that the mask fits properly so that the clamp on the nose there is secured tightly. So if there's any redness behind the ears or the head, I would put gauze lining the band there, and then I would reassess the patient's respiratory status. So listening to lung sounds, checking the rate and the depth of the breathing, and then I would replace the oxygen in the mask every 2 hours.